Today we have a very special guest with us, very important. We have Carol Jones. Carol is an RN. She's also a certified asthma educator, and she's a consultant for the Allergy Asthma Network Mothers of Asthmatics. And she's going to be talking to you today about the Allergy and Asthma Connection. Thank you, and welcome, Carol.
Thank you, Rebecca. Summer's right around the corner, and most of us with allergies are already having symptoms. So today we're going to talk about seasonal allergies and how they relate to asthma symptoms. 85% of the patients with asthma have allergies. 65% of people with severe asthma have sinusitis. And allergen exposure is associated with an increased risk of developing asthma, increased asthma-related conditions, more severe persistent asthma, but the good news is allergen avoidance can reduce airway reactivity and asthma conditions in allergic patients. Now, I want to show you exactly how the allergy and asthma are connected. So if you look at the picture here, if you breathe in, if you're an allergic person and you breathe in an allergen that you're allergic to into the nasal cavity, your nasal passages become inflamed and swollen. And if that's not treated, it can cause sinus congestion and or move into the lungs and cause asthma symptoms. So when you breathe it into your nasal cavity, it's not treated, it can go to your sinuses and or it can go through down into your bronchial tubes and cause asthma symptoms. If your sinuses are congested, you may feel a headache on the forehead, and I've just diagrammed there for you to see, and you'll feel a headache, and that's the frontal sinuses. Or you can feel pressure and pain in your cheeks, which is the maxillary sinuses. Whether or not you are likely to develop allergies is often passed down through families. If both parents have allergies, you will most likely have allergies too, especially if your mother is allergic. So you can see where the upper and lower airways are connected and how not treating one can relate and inflame the other. Okay? Now, the National Institute of Health created 6 messages for treating asthma, for managing asthma and keeping control of asthma. I'm just going to put them all down here. The inhaled corticosteroids is the first line of treatment to treat the inflammation in the airways. And those would be things like your Pulmicort, Flovent, Qvar, Asthmanex, those kind of inhaled medications. Monitor severity according to symptoms through a peak flow expiratory measure. And this is recommended especially for patients with persistent asthma or severe asthma attacks. Oops, I'm sorry, I didn't mean to get rid of that. Every patient with asthma should have a written asthma action plan to guide medications and environmental control. It is important to keep regular scheduled and even well visits and your planned follow-up visits to make sure that you're keeping your asthma under control. Even if you're feeling well, it's important to keep that visit. And then, of course, last but certainly not least, are allergen and irritant exposure control. Okay, our outdoor allergens that we have trouble with seasonally are trees in the early spring, which I'm sure in most parts of the country you're already experiencing, as well as grasses in the late spring and summer. Dry mold, summer and fall, and then weeds in summer and fall. Okay, the symptoms that you may experience are sneezing, often with the runny or clogged nose, coughing, and postnasal drip. And the postnasal drip can create a cough, especially in the early morning. So if you wake up coughing in the morning, it may not be asthma, it just may be that nasty postnasal drip. Itchy eyes, nose, and throat, and also dark circles under your eyes. Now you all are probably also, which I didn't include in this list, familiar with the allergic salute. You will see a crease at the top of the nose that is created by a person frequently rubbing their itchy, runny nose upwards. So if you run across somebody that's got dark circles and they've got that allergic salute, they've probably got allergies. Okay, outdoor allergens. Okay, we're going to just do that part first. Every area is different, and your exposure is different depending on the climate and where you live. So there's a couple places that you can check the pollen counts for your particular area, and one is the 800 number, and the other is pollen.AAAAI.org. And if you go on the AAAI.org, you click on your state, and it will tell you what the pollen count is in your particular state. Okay, air conditioning keeps pollen out, cleans and dries the air. Avoid fans and windows. And I know it's difficult if you don't have air conditioning, you want the windows open for that ventilation. So you might take some filters, some furnace filters, and if you can fit those into your window or some cheesecloth over the screen, that could help filter some of that pollen out. Change your car air filter regularly. Shower and shampoo after working and playing outdoors. Pollen is sticky, and it will stick to your hair and your clothes. And then if you go to bed at night and you haven't showered and shampooed, you're going to be laying in that pollen, and it's going to cause you problems. Avoid yard cleanup in the spring, and I would say in summer, or if you're cutting grass, wear a mask. Dry clothing in the dryer, not outdoors. And I know those sheets smell so good when they're dried outside, but it's really not a good idea because there again you're bringing that pollen into the house and sleeping with it, which is not good. Okay, other summer asthma triggers are fruits and vegetables, and people with allergies to grass, trees, and or weed pollen can cross-react to proteins in certain fruits and vegetables. And if this happens with you and you have those allergens, your lips will tingle, you get kind of itchy around your mouth and lips. If this happens to you, see an allergist to identify this and create a treatment plan for you. Now, humidity and cool breezes or wind that blows pollen around can also trigger asthma symptoms as well as allergy problems. Campfires, sitting by a bonfire, can cause an asthma attack, and that certainly is a favorite thing to do in the summer. Sit upwind from the smoke and don't get too close. And let somebody else roast that marshmallow for you so you don't end up getting exposed to the smoke. As far as stinging insects, if you're allergic to insects, cover up when you go outdoors. Avoid bright color clothing and perfumes or hairspray, and watch what you're eating, especially sweet foods and drinks. And I know of a patient that was outside drinking a can of pop. A bee went into his can of pop, but he did not know it, and no one else knew it. He drank the pop. He started having a very severe allergic reaction, and of course he didn't know what was happening, and nor did anybody else, and it had a very bad outcome. So be very careful when you're outside drinking sweet drinks. Chlorine in pools and hot tubs can cause eye and nose symptoms as well as asthma flares in some people. Okay, the seasonal pre-medicating. The first line of treatment for treating that inflammation in the nasal passages and sinuses that we talked about is a nasal steroid spray, and that might be something that the doctor has put you on. The second thing is an oral nasal antihistamine spray, and oral antihistamines are good. Nasal antihistamines actually block that mast cell reaction that you have when you breathe in something you're allergic to. The antihistamine nasal spray blocks that reaction. So your doctor may decide that you should be on both of those nasal sprays or one or the other. Nasal decongestants, spray no more than 3 days or oral decongestant. And with the nasal decongestant, don't overuse or don't use more than 3 to 5 days unless your provider has directed you to do so. Using too long can cause rebound congestion and make the nasal congestion worse. And I have seen that in patients, and it's very difficult to treat once they get that rebound congestion. Leukotrienes are singular, which I'm sure many of you are familiar with. Leukotrienes are a cell, an inflammatory cell in the body, and the Singulair blocks that particular allergic reaction. And it's typically given for allergies, and also people that have allergic component to their asthma can be a very effective treatment. And of course, avoidance of allergens, irritants, and pollutants. Now, there is evidence that the saline wash is beneficial in the treatment of chronic nasal and sinus symptoms when used alone or prescribed with medication. And in the box there, I put the recipe for a saline wash, and you just, use it in your nose once or twice a day, whatever the doctor recommends for you, and it really is effective and helps a great deal. Now, other treatments are allergy injections and Xolair. The Xolair is an injection as well. And these two things happen when everything else has failed, when your over-the-counter medications aren't working, your prescribed medications aren't working, your allergies are either out of control or your asthma just can't be controlled. The doctor may consider one of these two options. Okay. Now, a lot of people ask, what about being outside, exercising? I can't do this. I've heard many patients say, I can't go out. I have to stay in air conditioning all summer. Well, your quality of life is extremely important. So again, we want you to use all your medications, whether they're inhaled or oral, and exercise outside. 90% of patients with asthma report exercise as a trigger. And the exercise-induced asthma should be diagnosed by a specialist. Don't go on what you think or what people have told you. Make sure that it is diagnosed so it can be treated appropriately. And the symptoms for the exercise-induced asthma are, they may be accelerated with the season if you're outside and exposed to those pollens. You can have cough, wheeze, chest tightness, shortness of breath, and chest pain, especially in children. And I do hear this from parents every once in a while. They'll call me, they're worried about their child has chest pain, and it really kind of, directs me to thinking that it's exercise. And always talk this over with your provider and make sure that that's what it really is. Feeling out of shape when actually you're in good condition, and of course, fatigue. Now, it is important to stay active. If you normally exercise 30 to 60 minutes, maybe cut back on your time to reduce the exposure to the allergens that you're allergic to. Now, the treatment for exercise-induced asthma is use your short-acting bronchodilator, your albuterol, Zopanex, whatever bronchodilator it is that you're using, 5 to 20 minutes before you exercise. Be sure to warm up about 10 minutes before and cool down for about 10 minutes afterwards. Now I know we don't experience this right now, but when it comes to wintertime, cover your mouth if you're exposed to cold, dry air. And if it's very humid outside, if you've pre-treated, you should be okay, because what happens with exercise-induced asthma is that the airways become very dry and then start to cause you problems. So limit your exposure to seasonal allergens. Like I said, if you do exercise, only exercise 30 to 60 minutes. Cut back on your time, but stay active. And avoid going out in high zone ozone days. That would be something, if you have asthma, that we would want you to do. I hope this has helped you enjoy your spring and summer, and I thank you.
Great, Carol. Thank you so much for sharing that information with us. I think it's really great and helpful, and we also appreciate you sharing some of your personal experiences too. I thought we could do is maybe take this time to share with you another way that you'll be able to manage your allergy and asthma connection, and that would be by monitoring your lung function. You can monitor your lung function with Spiro-PD. Spiro-PD is truly the world's very first personal spirometer. So whether you're at home, whether you're at work, or school, play, you can monitor your lung function and be able to tell the severity of your condition right at a glance. Spiro-PD will also alert you if you're having a decline in your lung function before you ever even begin to feel symptoms. So that will help you anticipate and prevent exacerbations and asthma attacks, and that will ultimately help reduce those trips to the emergency department. SpiroPD will also allow you to track your trends. So you can view your data over the last 7 days, 14 days. You can review your data over the last few months, even years if you'd like to see how you're doing. SpiroPD is extremely easy to use. It has a built-in respiratory therapist that will direct you through the entire process. It will allow you to know when it's time to take a deep breath, when to exhale, and make sure that you know that you're doing the test properly. It will also improve communication with you and your doctor. You can very easily just plug a USB cable into your device, and then you can plug that into the computer, upload the data and the reports right to your computer, and actually send your physician over an email if you'd like. So we'll leave you with a quote. This is by Dr. Michael Blaze. He is the Board of Directors of the World Allergy Organization and a clinical professor of pediatrics and medicine at the University of Tennessee. Dr. Blaze states that with the increased prevalence of emergency department visits and hospitalizations for asthma and other pulmonary problems in the United States, SpiroPD can empower patients to monitor their disease and catch problems before they lead to costly emergency treatment. So we just wanted to leave you with that bit of information. And again, thank you so much, Carol, for your time and all of the information that you've given us today. If you have any questions, please enter them now in the Q&A box. We have Nancy and Carrie Ann standing by to answer any of your questions. They are the Q&A experts. Also, if you'd like to speak with somebody live, you can give us a call at 888-PMD4U, and feel free to visit us at spiropd.com or Twitter or our Facebook page. So again, thank you very much, and we'll hope to see you in the future at some upcoming webinars. Bye-bye.